In the small consultation room at Chicago Medical Center, in Chicago, I carefully observe Mr. Robert, a 55-year-old successful executive who, despite his impeccable suit and the confident demeanor cultivated over decades in the financial market, reveals a touching vulnerability as he addresses his intimate concerns. As a urologist and andrologist for 15 years, I've learned that moments like these are crucial for establishing a genuine connection with my patients. Dr. Emily, I never imagined I'd be here discussing this, he begins, adjusting his tie in a nervous gesture. But over the past few months, I've noticed some changes in my intimate life that have been worrying me. My wife has been understanding, but I feel something needs to be done. As I listen to his story, I recognize a familiar pattern. A professionally successful man facing the natural challenges of aging and seeking answers to maintain his sexual quality of life. Robert represents thousands of Americans who, upon reaching maturity, discover they need to adapt to a new physical and emotional reality. You're not alone on this journey, I reply, offering a reassuring smile. In fact, about 52% of men over the age of 50 experience some kind of change in their sexual function. It's a natural phase of life that, with proper care, can be managed, with excellent results. At this moment, I notice his shoulders relax slightly. The initial tension begins to dissipate as I explain that there are various natural therapeutic approaches that can help him. Among them, I highlight a technique that has revolutionized the lives of many of my patients: therapeutic penile massages. Dr. Google has probably already presented a wealth of information on the subject, I joke, eliciting a shy smile from Robert. But today we're going to talk about this practice in a professional and scientific way, understanding how it can benefit your sexual health holistically. Throughout my career, especially after specializing in sexual medicine at the University of Chicago, I have observed how this natural therapeutic approach can transform the lives of mature men. Penile massages go far beyond the physical aspect. They represent a path to reconnecting with one's own body and, often, with a partner. What impresses me the most, I continue, as I pick up some educational brochures I keep on my desk, is how this practice can not only improve local blood circulation, but also provide significant emotional benefits. Many of my patients report a considerable improvement in self-esteem and confidence after incorporating these techniques into their routine. Robert leans forward, interested. But is it safe, doctor? I mean, are there studies that prove its effectiveness? His question makes me smile inwardly. It's exactly the kind of inquiry I appreciate, showing a genuine interest in understanding the scientific aspect of the treatment. I open my tablet and show him some recent studies published in respected medical journals. You see, research shows that penile massages, when performed correctly, can increase local vascularization by up to 40%. Additionally, studies conducted at the University of Chicago have demonstrated a significant improvement in erectile function in men who adopted this practice regularly. As we talk, I notice that Robert no longer shows the same initial discomfort. His eyes shine with a mix of curiosity and hope. It's this moment of transformation that motivates me most in my profession, when a patient begins to understand that there are natural and effective ways to deal with the changes that come with aging. The secret lies in understanding that our body is a marvelous machine that responds positively to proper care, I explain. Penile massages are just one part of a set of practices that can help you maintain a healthy and satisfying sex life, regardless of age. While Robert absorbs the initial information, I take the opportunity to delve deeper into the topic, explaining the scientific principles behind penile massages. As a doctor, I always make sure to base my recommendations on solid evidence, turning complex concepts into accessible explanations. Penile massages work on different levels of our body, I begin, sketching a simplified diagram in my notebook. First, there's the circulatory aspect. By performing specific and controlled movements, we stimulate local blood flow, which is essential for tissue health. I take a strategic pause, allowing Robert to absorb the information. Then I continue. Imagine your circulatory system as a complex irrigation system. When we perform the massages correctly, It's as if we are unclogging and strengthening these channels, allowing blood to flow more freely. The use of analogies always aids understanding. I can see in Robert's eyes that the message is being well received. I then proceed with another important aspect. Additionally, there is the muscular component. The pelvic region has various muscles that directly influence our sexual function. The massages help relax these muscles, reducing tensions that can interfere with performance. At this moment, I pick up a bottle of essential oil that I keep in my office for demonstrations. Here's another interesting element of the treatment: the use of specific essential oils. Ginger, for example, is known for its circulation-stimulating properties, while lavender provides relaxation. The combination of these natural elements enhances the benefits of the massages. Robert shows particular interest in this point. And how does this association with the oils work, doctor? Is there any risk of a reaction? Excellent question, I reply, pleased with his interest. The essential oils we recommend are carefully selected and tested. We always recommend doing a sensitivity test before regular use. The important thing is to use high-quality products, properly diluted in a carrier oil, such as sweet almond oil. I take the opportunity to show him a small guide I've developed over the years, detailing the properties of each oil and their specific indications. See, for example, how ginger works. It promotes a mild local warming, stimulating microcirculation. Lavender, on the other hand, has a calming effect that helps reduce anxiety, which is very common in issues related to sexuality. The psychological aspect is another crucial point I make sure to address. You know, Robert, throughout my career, I've observed how the emotional component is fundamental in treating sexual issues. Massages provide a moment of connection with oneself, of self-awareness. For couples, it can be a unique opportunity to strengthen bonds of intimacy. I notice that Robert is taking some notes on his phone. It's rewarding to see a patient so engaged in their treatment process. For couples, I continue, I recommend incorporating massages gradually into your intimate routine. It's a journey of mutual discovery, which should be built with patience and dialogue. And what about the frequency, doctor? Is there a specific protocol to follow? The protocol we've developed over the years, based on studies and clinical experience, suggests sessions of 15 to 20 minutes, 3 times a week. However, it's important to emphasize that each case is unique. Some patients benefit from a higher frequency, others from a lower one. The important thing is to maintain regularity and be attentive to your body's responses. I take this opportunity to emphasize a crucial point. Penile massages are not just a mechanical technique, but a practice that integrates physical and emotional aspects. When performed with awareness and regularity, they can bring surprising benefits to overall sexual health. With the environment of trust established, I begin to detail the specific techniques of penile massages to Robert. I pick up an anatomical model that I keep in my office for educational purposes, making it easier to explain the movements and important areas. Before we begin any massage, I explain, it is essential to create a suitable environment. The room temperature should be comfortable, between 72 and 75 degrees Fahrenheit. A quiet environment, with dim lighting and, if desired, relaxing music, can significantly enhance the experience. Robert nods affirmatively, clearly interested in the practical details. I continue. The first step is always proper hand and area hygiene. Then, apply a small amount of the chosen oil. We usually start with pure almond oil before introducing essential oils. Using the anatomical model, I demonstrate the basic movements. We begin with gentle circular motions at the base, gradually progressing to the body and glands. The pressure should be controlled, enough to stimulate circulation, but never causing discomfort. And what about the duration of each movement, doctor? Asked Robert, taking detailed notes. Excellent question. Each movement should be performed for approximately 30 seconds to 1 minute. It's important to maintain a steady rhythm and pay attention to the body's sensations. If there is any discomfort, The pressure should be reduced immediately. I continue explaining a specific sequence I have developed over the years. We start with circular motions at the base, using the palm of the hand. Then we perform gentle upward movements, always respecting the natural anatomy. It's like a delicate dance, where each movement has its specific purpose. I pause to show a diagram illustrating the different types of movements. Notice how we alternate between circular, longitudinal, and gentle pumping motions. Each technique works on different aspects of circulation and tissue elasticity. For couples, I continue, these massages can be a special moment of connection. I recommend that each person first learns the techniques individually, and then they can share the experience. Communication is key, both about the pressure and the sensations being felt. Robert seems more relaxed now, asking specific questions about the technique. What about essential oils? How should I incorporate them? We start with a base of 30 ml of almond oil and add 3 drops of ginger essential oil and 2 drops of lavender. This ratio can be adjusted according to your sensitivity. The important thing is to always perform a sensitivity test beforehand by applying a small amount to the inside of your arm. I show him a small bottle with the mixture I keep for demonstration. Notice the subtle aroma. We don't want an overly intense fragrance, just enough to complement the therapeutic experience. During massages, it's normal to feel a slight local warming. This indicates that circulation is being properly stimulated. However, if there is any burning or discomfort, you should stop immediately and rinse the area with running water. I would like to address an important aspect. Massages should not be performed in cases of infections, inflammations, or skin injuries. If in doubt, always consult your doctor before starting the practice. And what about the results, doctor? How long does it take to notice any difference? The answer varies from person to person, I explain. Some patients report improvements in sensitivity and circulation within the first few weeks. However, for more significant results, I recommend a minimum period of 3 months of regular practice. The key is to maintain consistency and not rush. It's a gradual process of reconnecting with your own body. 3 months have passed since the first consultation with Robert. At our new meeting, I immediately notice a change in his demeanor, more relaxed, confident. His smile as he enters the office already indicates good news. Dr. Emily, I need to share with you how these past few months have been transformative, he begins, sitting down comfortably. I admit I was skeptical at first, but I decided to follow your guidance to the letter. As Robert shares his experience, I jot down some notes in his chart. It's rewarding to hear how the regular practice of massages has positively impacted not only his physical health, but also his emotional well-being. At first, he says, it was an adjustment process, creating a routine, finding the right time, learning the proper techniques. My wife was also apprehensive, but little by little, we became familiar with the practice. And how was this adaptation? With your partner? I ask, knowing that this aspect is crucial for many couples. It was surprising, doctor. The massages became a special moment for us. Beyond the physical intimacy, we created a space for emotional connection that we hadn't had in a long time. It's as if we had rediscovered each other. This is exactly the kind of outcome I always aim for in my treatments. A holistic approach that goes beyond purely physical aspects. And what about the essential oils? How was the experience? Fantastic, Robert replies enthusiastically. We started as you instructed, with pure almond oil, and then gradually introduced ginger and lavender. The gentle warming sensation of the ginger really makes a difference, and the aroma of lavender helps a lot with relaxation. I take the opportunity to perform some routine physical exams, confirming the reported improvements. The local vascularization shows visible signs of improvement, and the tissues are more elastic and healthy. You know, doctor, Robert continues, the most interesting thing is how this has affected other areas of my life. I'm sleeping better, feeling less anxious at work. It's like I've found a balance I didn't know was missing. This is a point I always emphasize in my lectures and scientific articles. Sexual health does not exist in isolation. It is part of an integrated system of well-being. This happens because therapeutic massages work not only on the physical aspect, but also on the entire nervous system. The relaxation promoted by regular practice has a cascading effect on the body. Another interesting aspect, Robert adds, is how this has changed my perception of aging. Before, I saw the changes in my body as something negative, a kind of inevitable decline. Now, I understand that it is possible to maintain a healthy and satisfying sexual life at any age. This shift in perspective is particularly significant. As a healthcare professional, I know that many of the limitations we associate with aging are more cultural than biological. The secret lies in adapting to the body's natural changes, not fighting against them, I explain. And how has the frequency of the practices been? I ask, adjusting my notes. I've been keeping up with the routine of 3 times a week, as recommended. Some weeks I manage to do more, others less, but I try not to skip. I've created a ritual, always at the same time, after my evening shower. That has helped me incorporate the practice into my daily routine. During our follow-up consultation, Robert shares some challenges he's faced throughout the process. As a doctor, I know that these moments of difficulty are just as important as the successes, as they reveal areas that need special attention. At first, he shares, I struggled with consistency. Some weeks were busier at work, and I ended up neglecting the practice. But I realized that the more irregular it became, the longer it took to see results. This is a crucial point I always discuss with my patients. Consistency is key, I explain. It's like medication. It needs to be taken regularly to work. How did you overcome this challenge? I started blocking specific times in my schedule, like I do for important meetings. I also shared more openly with my wife about the importance of this practice for my health. Having that support made all the difference. I'll take this opportunity to make a few adjustments to your guidance. I see you found a good balance. Now we can start introducing some variations in the techniques, always keeping the basic principles we've learned. Robert also mentions another common challenge. There were moments when I felt anxious for quick results. It took a conscious effort to understand that it's a gradual process. That's very common, I reply. Our society is conditioned to seek immediate results, but the body has its own timing. What's important is to celebrate the small victories along the way. I share with him some success stories from other patients, always preserving their anonymity. I had a patient who took 4 months to notice significant changes, but when it happened, the transformation was remarkable. Each body responds in a unique way. One interesting thing I noticed, Robert added, was how the practice helped me better handle daily stress. It's like I discovered a new form of self-care. This is a secondary benefit I often observe in my patients. Therapeutic massages end up becoming a moment of mindfulness, a connection with oneself. Conscious touch has a transformative power that goes beyond the physical aspect, I explain. What about the oils, doctor? I noticed that on colder days, the effect of ginger seems more intense. Exactly. Room temperature can influence the body's response to essential oils. That's why I always recommend adjusting the proportions according to the season and individual sensitivity. I make a few adjustments to your prescription, considering the colder period ahead. Let's slightly reduce the concentration of ginger and increase the lavender. This will maintain the balance between stimulation and relaxation. Robert then shares an interesting discovery. You know, doctor, I've started noticing patterns in my body. On days when I'm more stressed, the massage needs to be gentler. It's like I'm developing a new way of listening to my own body. That's exactly what we're looking for, I exclaim, pleased. The practice of massage isn't just a mechanical technique, but a way to develop greater body awareness. This ability to self-assess is extremely valuable for overall health. During our last follow-up appointment, Robert arrives with a special sparkle in his eyes. 6 months have passed since our first meeting, and the transformation is remarkable. not just in physical aspects, but especially in his attitude toward health and well-being. Dr. Emily, I need to confess something, he begins, smiling. When I first came here, I was quite skeptical about this whole process. Therapeutic massages, essential oils, it all seemed so far removed from my reality. I smile back, remembering our first conversation. And what changed your perspective, Robert? It was a combination of several factors. First, the way you explained the entire process, with scientific basis and clarity. Then, the results I started to notice, not just in sexual function, but in my overall well-being. And perhaps most importantly, the change in my relationship with my own body. This is one of the most rewarding aspects of my work, seeing how a seemingly simple intervention can catalyze such profound transformations. And how is the practice of massages going these days? It has become a precious ritual, he replies. It's no longer just a technique to improve sexual function. It's a moment of connection with myself, of personal care. My wife has noticed how I'm more present, more emotionally connected. I make some notes in his chart, recording the changes observed over these months. What about the essential oils? Did you manage to find the ideal combination? Yes. After some experimentation, we found the perfect balance. Ginger really makes a difference in circulation, and lavender helps a lot with relaxation. In fact, I started using lavender in other situations, like before bed. This is an interesting point I always like to explore with my patients, how a specific practice can open doors to other healthy habits. I notice you've developed a new relationship with self-care as a whole. Exactly, doctor. I started paying more attention to other aspects of my health as well. I improved my diet, went back to regular physical activity. It's like I woke up to the importance of holistic care. I take the opportunity to conduct the follow-up exams, confirming the improvements that Robert reports. The results are impressive. Better vascularization, greater tissue elasticity, and a more efficient response to stimuli. You know, doctor, he continues, something that struck me was how this process affected my relationship. My wife and I developed a different kind of intimacy, deeper. It's not just about the physical aspect, but about sharing vulnerabilities, fears, expectations. This is a result I often observe in couples who engage together in this journey. Healthy sexuality is much more than physical function, I explain. It's about connection, intimacy, self-awareness. Another interesting aspect, Robert adds, is how this changed my perspective on aging. Before, I saw every change in my body as a sign of decline. Now I understand that it's possible to age healthily and maintain an active and satisfying sexual life. We concluded our consultation by discussing the next steps. Robert no longer needs such frequent follow-ups, but we will maintain periodic meetings to monitor his progress. Keep up with the practices we've developed, I advised. They are now valuable tools in your health journey.